Good morning. I would like to call to order the March 2023 Pitt County Social Services Board of Directors meeting. As usual, we would like to first take a moment to observe a silent prayer, a prayer or silent meditation. Thank you. So you should have in front of you or received a copy of today's agenda. Do we have any changes to our agenda today?
Yes, Vice Chair, we have the amendment to the agenda would be the Community Partners presentation with Chandra Mewborn has been canceled. And in place of that, Keisha Adams Council will be talking about Child Abuse Prevention Month, which is in April.
Okay. Do we have any public comments? No. All right, you should have received minutes from our previous meetings. Are there any changes?
Mr. Vice Chair, under board member comments, Catherine Nelson is listed as Catherine Bunch instead of Catherine Nelson.
Okay, that change noted. Any other changes? Can I have a motion to accept the minutes?
I'll make a motion to accept the minutes.
Second.
All in favor?
Aye.
Aye.
Next, we have a recognition of our new hires and retirees.
So I will call your name if you could just come up to the podium, introduce yourself, and just give us a brief overview of what you've done and what your new position here is at Pitt County. The first person would be Christopher Bryson. Is Christopher here? Oh, all right. Okay, let's start that again. Talia Williams. Welcome, Talia.
Hi, I'm Talia Williams. I come to you from Whitakers, North Carolina, and I was part-time and now I'm full-time for Pitt, and I do CPS in-home.
Wonderful, thank
Thank
you.
you.
Thank you.
Welcome.
Shaquilia Rogers.
Hello, my name is Shaquila Rogers. I am a child support clerical, and I
Wait a
am
minute,
for
something's
William-
wrong with your microphone.
Can you tap it?
Is that better?
Tap it. Yeah.
Thank you.
Okay. My name is Shaquila Rogers, and I am in child support division. I'm child support clerical, and I am for Williamston, North Carolina.
Thank you.
Welcome.
Thank you.
Welcome.
Myra Harris.
Good morning. My name is Myra Harris. I am in the Adult Service Unit, specialized in the Special Assistance Program, and I started as a master's intern, and now I'm a full-time employee. Thank you.
Hey,
Thank you.
congratulations.
Welcome.
Kertisha Kennedy.
Hey y'all, I'm short, so I'm gonna stand on my tippy toes. My name is Cortesia Kennedy. I'm also in the Adult Service Unit. I will be in the CAP division. I also started out as an MSW intern, and now I'm a full-time employee.
Congratulations.
Thank you. Welcome.
Nice pipeline.
Tiana Beal. Okay, Tiana, welcome. Shanita Witherspoon.
Hello, my
My name is Shanita Witherspoon. I have been employed with Pitt County government for 7 years. I was employed with, I'm a returning employee, put it like that. I left Pitt County DSS in September of last year to go to Pitt County Board of Elections. So I am returning back to Pitt County Department of Social Services in the intake department with food and nutrition benefits unit. And I am glad to be returning back home because DSS is where it's at. Thank you.
Thank you.
Welcome back.
Thank you.
And last but not least, Shawnette Wilson.
Good morning. My name is Shanette Wilson, and I am in the Adult Services program, Adult Services unit. I will be working with in-home social worker, and I was employed with Pitt County for 4.5 years part-time, and now I'm here. I started here on March the 6th, so thank you.
And you're full-time?
Thank you.
Excuse me?
And you're full-time?
Yes, ma'am, I'm full-time
Wonderful.
here. Thank you.
Wonderful, thank you.
Thank you.
Okay, that's it, and there's no,
All right, thank you and welcome everyone. Next, we have items for report. Ms. Keisha Council, Adams Council. We'll move on to Mr. McQuinn. PJ Quinn, budget update. I'm sorry.
No problem. Good morning. I'm a returning employee too, just for a short time though. And glad to be able to do it. As you well know, we have to do the 23-24 budget. That's what I want to talk to you about today. I want to give you a little bit of the philosophy behind how we approach doing the budget this year. We get we get instructions from the state and the county, and then, of course, what needs to be done in the DSS. This year is a little different in that we were instructed by the county that this is not an expansion year, so the budget's going to be probably a little less money coming our way because it's not an expansion year. But we went through, what I did was I went through and I looked at all of what we had spent last year and the year before and where we were spending our things. Each one of the managers of the different units sent in their request of what all they wanted it to do. Then we looked at what we thought we could fund within it. So this year, our new budget it's into the county manager's office now. They haven't, as far as I know, started processing it yet. But we're asking for our total budget, bottom line is $35,578,730. That's what the total request. The one thing I do want to mention to you on that is that last year our total budget was like $35 million, so it's pretty close to the same as it was last year. But we are requesting from the county this year approximately $1.5 million more in county dollars than they had to put in last year. And I'll try my best to explain to you some of the reasons why that is. One of them is, of course, everybody, last year they all got pay raises and stuff, and so that ended up starting the salaries are higher this year than they were last year, so that accounts for some of it. Miscellaneous expenses, all of us know that cost for anything and everything has gone out of sight. So a lot of things that we were doing, just day-to-day operational things, we had to ask for a little more money in order to keep on doing those day-to-day things. Such things as utilities, temporary employees, automobile upkeep, those laboratory expenses, psychological evaluations, all of those kinds of things had gone up. In addition to that, you heard a briefing last month on foster care. The heavy increase in county-only dollars for foster care people. This year, last year they budgeted $100,000, I think it was. Well, this year we're budgeting $500,000 because we're going to spend over that, it looks like, this year, and so we're trying to keep up with it. And we have no way of really controlling that because it depends on the children that come along to us. Another thing I wanted to tell you, the state gives us what we call the state numbers, and a lot of the money, they mandate the services that we have to provide, but they do not give you enough money to do what needs to be done. For example, they give you $1 million thereabouts every year to do crisis intervention to help folks. The payment, the $1 million is for the payment, but they give you a whole $162,000 in administrative money to administer the program. So there's a lot of shortfalls in all of that type of thing. So the other thing I want to tell you is our philosophy we're going in with this budget is we're not asking for a single new position in the new year. Now,
Will you want to repeat that?
Yes, ma'am. We are not asking for a single new position in the new budget. There's some philosophy behind that. It's not because we don't need them, because I'm sure we do. But, in fact, the managers of the agency sent in a request for about 60 new positions, but because it's a non-expansion year. But the big driving force behind that is the fact that as of yesterday I checked, we still have 57 vacancies. New positions won't do us any good if we can't get bodies to fill the ones we got. So that's kind of where we were looking at that kind of thing. We do want to put out on the table, though, that as the year goes along next year, we may have to relook at all of this because we might have to have new positions simply because you've heard on the news about the Medicaid expansion. That's going to happen. It probably will require new staff. I think Brian did a mathematical, I don't know, he looked at how many cases they were expecting and how many people it would take to do based on the number of cases the state says you're supposed to have. And he came up with like 20 new positions would be needed. And that's probably going to be the case. But right now, we're not asking for any new positions. But we do want to go on the record to say that we will probably have to have the county relook at us next year, depending on what happens and where we go with this type of thing. So bottom line is we've done the very best we can to get this thing in balance and make sure that we can continue to operate with the money that we have in the best way we can. As of right now, there's no pay raises or any of that type of thing in the budget. The county will let us know if and when to put that in there. So that's where we are. Do you have any questions? This is just sort of a big overview of the budget. Nothing is in stone yet because, like I said, the county manager and them have not done their magic with it yet.
Why do you think we have so many vacancies?
I don't know. I know that everywhere I go, I see now hiring, so it appears to me that the applicant pool must be very low. People, I don't know why people are not working. Maybe Ms. Rochelle can answer that question.
So I believe that we're making every effort to fill the vacancies that we have. The people that come on, that have been in the county that have helped us from the state have mentioned that Pitt County is one of the only counties that are still getting applications, that many of the positions in other counties, they're not even getting an application for that. So I'm hopeful with that. I think we're not the only county that's experiencing this. Unfortunately, I think it's statewide, and I also think probably nationally, people just don't necessarily want to take these positions, and so the reflection of that, unfortunately, is that there's vacancies that result.
So do you think it impacts morale? How is the morale here in Pitt County? Since we have 57 vacancies, that means someone is doing the work.
Right. So I think staff knows that we're doing everything we can do to fill those vacancies. We're not just ignoring the fact. I also think I have been working since I've started in October trying to make the environment and the culture here a place where people want to come to work. I know that I'm not going to please everybody by any means, but I think people realize what my philosophy is, and they're working towards a place where people want to come to work, and hopefully we'll get those vacancies filled. Unfortunately, no matter where I've ever worked, especially when it comes to the child welfare side of the house, you just get that turnover. People, start come in with the idea that they really want to do the very best to make a difference in a child's life, and then there's the reality of the work. That's, I think, disappointing sometimes, but it's whether or not people can tolerate it.
How has that, I think we went back to, what's that time period of having, I won't call it bonus time, but adjusted work schedule.
We're still doing that.
We're still doing that?
Yep, and
Because that was a good morale booster for the employees.
So I've opened that up to the whole department, as well as we're working out a plan to try having a remote work site. Actually, one of the things I was going to talk about, but I'll bring it up now while we're on the subject, is I'm going to be, on Saturday, I'm going to go out to Bethel and work with Dr. Silvernail on seeing what part the Department of Social Services can play with their Pit Stop initiative, where instead of being in this building and having people come to us, that we're going out to the communities to be able to see where the need is and what we can do to get ahead of that, instead of waiting, until things get terrible within a family, and trying to be more proactive and preventive in nature. And hopefully, as that initiative continues to grow, we will be part of that, starting with this needs assessment that's being done. So it's more than just even having to, more than remote work and being able to work from home and have a home office. It's also get out in the communities in Pitt County, and try to
Yes.
get ahead of the work.
Yes, because that is a concern that I have about the outreach and outlying areas of the county that have very little access to the services that Pitt County offers. And I know, and I think, PJ, it's good to see you come back. I know that you're working with it and you're doing the best you can. And thank you for leaving home for your retirement.
Glad I could
But
help.
I like this. I put some numbers up as it relates to the culture that Pitt County has. Because we are growing, because every time you go in a store, you say, I came here from this place in New York or here. Oh, I love it here. And you ride on plane and the lady tell me it's the best place in the world. So our services make us be who we are. And as long as we can reach out and show that we are very cognizant of how people fare. But I'm still seeing the people standing on the street corner at the signs. And that is concerning for me, and I'm not blaming anybody, but it say a lot about services, social services, and mental health services. So I'm concerned about that.
Okay.
And so that's probably what I wanted to talk with you about as I come. But your schedule, my schedules are not knocking here. So thank you so much, PTA, and I appreciate it. And I certainly hope we can fill that 57.
I hope you can too. It's
Where we advertising?
So just everything goes through a posting through the HR department. So it's on the county website. I have asked if it would be possible to do something through LinkedIn and Indeed. At one point, I think the county did advertise, and so they were going to look into that for me, just to be able to put the information out.
Thank you. That's creative. Thank you so much.
I do think that in the last month or maybe 2 months, that there were some departments that actually did pretty well in filling, I think, Brian and yourself. So I think we're plugging away. I think Dr. Cheryl has done some things, but hopefully we'll get some things turned around. Thank you, Mr. McQueen. Brian?
Good morning.
Good morning.
I'll begin with the report on food and nutrition services. Currently, we have 597 applications pending, and that's down from 672 this time last month. So we're managing the applications that are coming in. We are managing well, staff are working well. I will share that out of all the intake positions in food and nutrition services, all the positions are filled, and we have two new employees who remain, who are still in training, but the other 9 are out of training and are working with cases. So the work of getting the positions filled and the folks that have come in that area, it is showing up in the work product and the volume of work that we're handling. For Medicaid, the month of February, our agency did not pass the Medicaid processing report. 90% is required, and for the MAD applications, we were at 84% timely, and all other Medicaid applications, 88% timely. We do have several vacancies in the Medicaid intake area. We have 6 in the Medicaid intake unit, and we have 3 in the Medicaid long-term care section. But what the good news of this is, of the 6 that are in the Medicaid intake section, all of those employees are still employees of Pitt County DSS. It was due to promotions within the Economic Services Division, and some were promoted into the Family Support Services Division. So we're happy about that. Even though there are vacancies there, all those folks are still with us and working for Pitt County DSS. So we're in the process of utilizing former long-term care Medicaid workers to help work with us part-time to assist in working on cases in that area, and we will continue to work on filling our positions in the Medicaid area. We did have good success with filling positions in the area of food and nutrition services. Now I'll move on to the utility assistance programs. The LEAP program, as of February 28th, we had assisted 2,888 households, and the amount approved for those households was $1,013,600. We had, as of the end of February, $498,151 remaining. It's important that anybody interested in applying for LEAP do so by Friday, March 31st, because the program runs December 1st through March 31st, so that will be the last date that applications can be made for the LEAP program, and the application period will close then. The water assistance program for February, in February we received an additional allocation of $279,152. As of February 28th, we had assisted 1,149 households, and the amount approved for those households was $373,317.41. So we still, as of the end of February, we still had $255,000 remaining in that program. So that program is still operating, and will continue operating as long as the funds remain. We have funds available there. I'll be happy to answer any questions you have for me.
Do you see any impact on the differences in how we're doing LEAP now than what it was before COVID?
Yes. A lot of people are utilizing the online application process, but those that don't want to use the online, we can still do an application by telephone. And because of a waiver we had, if they give us permission, they don't actually have to physically sign the application. We can document it that it was done by telephone, and they gave authorization to do it that way. So someone that cannot get into the agency still has that method of applying by phone. Some have called and said, just mail me an application, I'll fill it out and mail it back. At this point, it would be better for somebody to do one by phone because, we're almost 2 weeks away from the end of the month to be sure they get the application in. So, but having it opened up, a lot of people have enjoyed using the online application process because they're not coming in, sitting in the lobby waiting. They can just do it from home and they don't even have to come into the agency. That's worked very well, that process. But there's still, for people that don't want to use a computer, there is still an option.
What, have you kept statistics based on how many use telephone, how many use computers or whatever?
I could get the figures of how many have applied online. I could get that figure,
That would be
yes.
nice because
Okay.
the outlining areas do not have internet. And I'm sort of
Right.
concerned, as a matter of fact, I've had some people that ought to track me down.
Right.
So maybe if you keep some statistics, we could make some judgment based on that.
Yeah, I can get the figures for the E-Pass applications, and we'll know how many are applying that way and how many are applying the traditional way. But I would recommend, we're happy to do one by phone. If they want to call, but they can do it by phone and get the application registered that way, and there's still time to do that.
Has it been a problem between those, before you had to have ID?
There's no requirement for an ID to apply for the utility assistance programs.
So that
They can
is-
provide their utility bill. They don't have to have a picture ID to apply for it, but they are providing something that we verify their utility account, and many of them do it through, it shows where they're living and who the account is with.
Okay, thank you very much.
Thank you. Thank you.
Brian. Next, we have our director's report.
I think Keisha's gonna.
Oh, I'm sorry. I'm sorry.
Yeah, that's okay.
Good afternoon. My apologies, got tied up with another county, making a request. So I'm here to talk about Child Abuse Prevention Month is April. Some of the activities we have scheduled for next month include our annual walk. It will be held on Monday, April the 3rd at 9 o'clock at both buildings, outside the county office building and over at the Human Services Center. So if anybody wants to come out and join, we will be wearing blue T-shirts, and we will walk around this side street all the way down and around through Fifth Street. A few more activities. We're going to be setting up booths at some community resources. They're having little functions, so we're going to be set up and work with the health department on April the 15th and with Delta Sigma Theta sorority on April the 29th. The city of Greenville will light up the bridge blue the week of April the 9th. So those are some of the activities we have planned. Any questions?
Yes, do you have a way of extending your activities beyond the city of Greenville?
Well, we're still, if somebody is having an event, they can contact us and we will come out and provide educational materials regarding child abuse prevention, as well as information on how to seek services through the county, through DSS. So if anybody has any events planned, they can contact us at 902 1281, that's my number, and they can call and just let me know what events they have planned, and we will send workers out to set up. We had a child abuse prevention festival pre-COVID. We are hoping to get back to that next year, and looking forward to doing some things outside on the north side of the river in the future.
Has there been any difference in your statistics as it relates to outer edges of Pitt County in addition to city proper of Greenville?
I would have to check our database to see specifics as far as areas, which areas we receive more reports in. I know at one point we were looking at doing things on a regional type in regions, but I would have to check on that information.
Has there been any differences between, I have a lot of questions today. Because I'm seemingly not without knowledge but some concerns. You see what's happening in the neighborhoods with the young and the youth, doing things that I'm not aware of them doing before COVID, and it concerns me. So I like for maybe some good statistics as it relates to, is there more abuse now than it used to be? Have you noticed some occurrences now that's happening, and probably looked at why they may be happening?
Well, without having the data in front of me, I can't.
I'm not asking for
Okay.
it today.
Okay.
But I like for us to start being conscious of our numbers and what's happening in the community, and present to me some, so that I can make some consensus as it relates to how we are faring socially in the communities who are not accessible, and numbers can tell you that. I'm not saying you're weak or anything, but they're child abuse, and you hear that so many more people are in the jails that have mental or issues or medical issues, and if we don't pay it one way, we're going to pay it some other way. So I like for us to be a bit more, not aggressive, but
Proactive versus reactive.
Yes.
And we are moving towards that by educating more. We have, we're coming up with some ideas to address some of those things, because my philosophy is educate, not substantiate. So if we can get out beforehand and educate some of the people on things that, can't necessarily do the things that your parents did, or things that discipline is not the same, it's not accepted as it may have been years ago with the methods that people use. So it's going to all be part of educating, what's acceptable in society. So yes, we have talked about that, and we have discussed, we know that mental health is a big issue. We know that drugs is a big issue. And, we sometimes call it a trifecta when they have all those things going on at the same time. So we realize that the community has a lot going on, and we're trying to educate. So our focus now is education to hopefully prevent child abuse. And that's part of getting out in the weeds, like we like to say, and start getting more involved. So like I said before, when communities have events, they just need to reach out to us so that we can show up and provide that education.
I like to see us to be proactive and keep statistics, because people are afraid for some reason or another as it relates to something. And maybe we can do a little bit or something of finding out what's happening with the social health and the mental health of our residents.
Yeah, we want the community to know that we're not the enemy. CPS has a reputation of being baby snatchers and other things, but that's not the case. Our role is to strengthen families and empower families, and we want to help when they're in crisis, to give them the tools to make those needed changes and provide them with assistance and identifying resources when they are in crisis. So we want to get out in the community and be able to show them that we're not here to hurt, but to help.
The educational facilities that we have here, such as social work, and maybe at Pitt when we have some programs and stuff, I think do we partner with them, and have we made efforts to bring them in to assist and help out in some of this that can ease the load and help us bear the burden?
Do you mean ECU or?
Both. Do we have a internship with them?
Oh, yes.
Partnership, that's what I call partnership. See, I'm purely public. I don't go to the campuses unless I have to, and you don't get popped. But I mean, we're doing a job for the residents, And the fear is there. I just don't know how to say where it coming from.
Well, I think it's, the Department of Social Services, and I'll speak for Pitt County, but in general, I think we have to change our public image.
Yes.
And to be one of being helpful and trying to get ahead of things before, it comes to the worst case scenario. I think being out in the communities, like participating, as Keisha just said, to do, outreach and education. The Pit Stop Initiative is the beginning of that. I would rather go into a community and find out what we can do to help before they have to make a call.
Yes.
What can we do to prevent that?
Yes.
And change the way that we do business as more of a helpful, proactive organization and not, wait. I think when you remain in a building under a roof and you're not visible in the community, they have one perception of you. That's why we need to be out there and be more visual and show people that we're really there to help them.
Thank you.
So, and interestingly enough, I don't know if you're done asking questions for Keisha, but I was gonna go on to this displaced youth
Yeah, I'm finished
thing.
with Keisha. I
Okay.
just, it wasn't just for Keisha.
No,
It's
I know.
The
Well, I think
social
that-
services as a whole, and she
Thank
just
you.
happened to be the guinea pig.
Yeah. So kind of tying into what we were just talking about. So as PJ mentioned, how our foster care amount has gone up significantly. So what we've been experiencing as an agency are young men and women, typically teenagers, who get to the point where their parents just want to give up their custody of their children, leave them at the hospital and don't pick them up, leave them on our doorstep and say, we don't, we're done, we don't want these children anymore. And then, of course, that precipitates a child protective referral and then trying to figure out what to do to help the child and the family to get through these difficult times. When a child comes and we have no placement for them, we have to look for a respite for them, and that's total county dollars. So typically, and I'll just give you one example, youth came in, it's $240 a day to keep the child in a respite placement. There is no reimbursement. It's total local share out of that. So one of the things, and since I've been here, we've experienced this on several occasions. Children have had to sleep in the agency, which is not conducive. They're not getting their education here. So on Friday, I've asked all of the community partners, a representative from the Sheriff's Department, DA, mental health, everybody come to the table to let's talk about these youth. Let's not wait until they end up at one of our doorsteps. Let's try to, plan something ahead of time. How do we manage these kids? What can we do together? It should not just be the Departments of Social Services responsibility, but a community responsibility. And it's not one person's problem. I think the departments looked at like, well, they have access to different programs. Yes, we do, but we don't have a place for these children to go either. So what can we do to change that? And how do we work together? So I'm hoping that from this meeting, we get on board and start having monthly meetings when we know these children will probably come our way. Not that we can always plan, but at least to be able to get ahead of it. So it doesn't matter to me, what we have to do to keep the kids safe and in a safe place. What matters to me is that we're giving them a quality place, that they're getting their education, that they're not sleeping on a blow-up bed in one of the offices.
Yeah.
But what else can we do to make it a better situation for them? So I think many of the issues that we have really needs to be handled by the community and not just by the department. I think that's where we're gonna grow, meet the need of the community and kind of, move the agenda forward to help everyone. you know, they say it takes a village, absolutely.
It
And
does.
it's just not the Department of Social Services. We want to be part of all of that. We want our image changed, but we know we can't do it alone.
Because we do have a shortage of houses, and people are having a hard time. I get calls all the time about where to do. Do you know a vacancy? All about that. So somewhere, somehow, a child that doesn't have a place to go is vulnerable for other problem created. And
Absolutely.
so that really does hurt the community as well as each one of us. So I don't know what we're going to do about it.
So I met this week, Mr. Rhodes and I met with, it's called Shelter Pallet, or Pallet Shelter. And it's temporary housing, and trying to look for alternatives for people, even temporarily. What we know right now is if a family needs, are, you know, evicted or whatever, and they're looking for a place to stay, the homeless shelter right now is not taking families. And so people are probably living out of their car. We know that's happening. But I don't have an alternative. I don't have to say to them, okay, well, here's a place that you can go, that you would be able to, you know, find an apartment or a house to live in. And I'm not gonna remove kids because of that. I'm not gonna take kids out of a situation. It's not the parents' fault, it's because there's, and I don't even really wanna say poverty, because even working families, the working poor are experiencing this.
And they have no place to go, and they gotta get out.
That's right, so.
I don't understand.
I have no answer, and if they're taking care of their children and loving them and doing what they need to do, hopefully we'll put our heads together and come up with an answer, but taking the kids away from their parents
No.
is not a
Not the
solution.
answer.
So,
I'm been hit with that more than before.
yes.
And they got to hunt me down because I'm not in the office and I'm moving around. So,
So I wish there were answers, Ms. Mary, better than what I have, but I'm working on what we could possibly do for a solution. Seems like it's just kind of hit all at once, so.
it seems like it.
Mhm.
Okay, well, thank you. I just, you know, I always try to look out of the box and search around the box and then try to see what it is. But just to come and meet and talk about our issues and talk about our problem is not the answer. We got to be proactive, aggressive, and everything else.
Absolutely, I agree.
Did I mess up your report?
Oh, don't worry about it. Hey, you know what? It comes from your heart, and that's what matters. And so, really, I've talked about the two things that I needed to, and a little more, but that's okay.
That is okay.
Yeah.
All right, thanks everybody for their reports. We have board member comments now.
I'd just like to say happy Social Work Month to everyone. March is Social Work Month, and the theme this year is Social Workers Break Barriers, and that's what we're talking about today. Happy Social Work Month. Welcome to all of our new employees. I'm excited about all the efforts to provide wraparound services. That's what we used to call them, wraparound services to families in our communities, because it does take a village to make all of this work. Thank you.
Every now and then I feel like I have to look at our population and look at our counties and look at beyond just my district. And so what I've pulled up, and I want to share it with you so that I feel like this is I asked our statistical people for statistics based on the various cultures we have in Pitt County, how many there are, different statistics about it. And I wanted to share it with you because I realize you were new, and we've not had an opportunity to get together. But it's eye-opening, and I like to share this with you because to know that we have some 269 various cultures here in Pitt County, that's a large range. And I don't know how many on the board know that, but every now and then, that statistic there alone gives you something that say we have just beyond the norm. And this is an attractive county for the area. So I want to share this with you. And of course, when I look at the whole Pitt County, I look at my district. So, thank you. Sometimes we just have to think of things to look at and share and know what it is. But did you know that we had 269 different cultures? And we serve on the Social Service Board. We're addressing their needs in their communities. So I like this for us to get some excitement about people we serve and just think and creative. I'm the least social worker on this, I'm the least social worker on this board, and so I try to make up for my weaknesses. And so that's what I did this time. So not to pick on anyone, but just to enlighten and share with the community that we have these many people that we have to serve, and we need to be kind and persistent and aggressive about how we look at things. Thank you.
And Miss Mary, would you be all right if I copy this and make sure all the
That's
board
what I want you
members
to do,
have
but I
it?
want you to give it back.
Oh, all right.
And I'd like for you to share it with the colleagues on the
Yes,
board.
that's what I meant.
Because I asked particularly for the various cultures, and then I want it because everybody look at District 2 as the district that have needs. We're not the only one needing. So I always look close because these people rely and depend a lot on me. But I like to share it with you all also because the outlining areas does not have the wherewithal to just come to Greenville. Everything to people who live in the rural area is a trip.
Yes.
It is a trip. I have to schedule when I come into the city. I don't live in the city. And it means that you have to decide if you're going to make 15 trips or 5. So that helps your economics. So I like to encourage all of you who do a lot of running to the store every day. If you're passing it, make your list out before you leave home. And let's start being a bit more frugal in how we handle our monies and our resources so we can keep our taxes intact. I know I said that for a reason. And thank you very much, and I appreciate it. And welcome to Pitt County.
Thank you.
Thank you.
I'll just say thank you so much to Ms. Rochelle for thinking outside the box. I think it's so easy for us to operate in silos. And we have multiple organizations right here in this building that work with our children across the county. So to begin to collaborate and realize that it's not any one agency's problem to fix or solve or address, it's our community.
It's the community.
And so I really appreciate your efforts to collaborate and put heads together and think, oh, we don't know what to do with this today, but oh, you do know what to do with this today, and maybe tomorrow we know what to do with it, and the other one doesn't. But that collaboration is absolutely crucial. And Sheila and I are absolutely on the same wavelength today. That does break barriers when we work together and we collaborate. And that lives out this month's Social Work Month of breaking barriers. So also, happy Social Work Month to all the social workers who are here, and thank you so much to every single staff member at DSS, whether it's a social worker, a payroll employee, every single person
Or a jail
is needed
attendant.
to make it happen. So thank you.
All right, thank you for those comments. At this time, can I have a motion to adjourn?
I like the motion to adjourn.
I'll second.
So we adjourn.
Aye.